Hello, I'm Catherine Haynes, Professor of Accounting from Northumbria University. This reflective essay on structural inequalities and the role of accounting is really a provocation asking people to think differently about the role of accounting in our society. I was stirred by the very real effect of inequalities in the recent COVID pandemic to think about how accounting as a concept is implicated in some of these inequalities. For example, I'm referring to the fact that we know black and minority ethnic people were disproportionately affected by the COVID outbreak. Similarly, people living in impoverished households with multiple health inequalities are also more at risk. So I wondered how accounting could help us address some of these inequalities differently. Accounting as a concept is a tool by which we render things measurable by numbers. It's also a social construction, which really means that it's a concept that's been made up by humans and become solidified and codified over hundreds of years. So if you think about it, measurement and therefore accounting underpins virtually everything in our society. It informs how we measure things and what we measure. And I argue therefore that it is implicated in how we account for inequalities. So COVID has brought us a real opportunity to rethink how accounting numbers and calculative practices can be amended to give us better information with a sense of purpose that helps us overturn inequalities. So in this paper, I'm arguing for an accounting for care. And by that I mean forms of accounting that enables us to care and care better. Requirement for care is all the more evident since COVID, whether it's caring for ourselves, caring for others, mutual care between peoples, or even caring for the planet which sustains us. So we need forms of accounting that will help us drive improvements in these areas. Robust data in public accounting are essential if we're to understand the scale of the impact of the pandemic and related inequalities. And therefore an important driver for accounting metrics is to support decision makers with appropriate data to counter these various forms of inequality and lack of care that we've seen during the pandemic, whether they're derived from poverty, age, health, race, gender or other characteristics. Within organisations, accounting enables us to make better decisions. So I'm challenging businesses and organisations to account for the care they offer their employees, paying a living wage, supporting inclusivity, offering flexible working and methods, moving away perhaps from 0 hours contracts which fuel precarity and therefore inequality. So, in summary, understanding the role of accounting in exacerbating, perpetuating and challenging experiences of inequality and the role of care is essential if such inequalities are to be addressed.